Good afternoon. Welcome to Thurston County Board of Health meeting for Tuesday, January 12th, 2021. My name is Ty Menser, Chair of the Board of Health. We have the Vice Chair of the Board of Health, Commissioner Carolina Mejia, and Commissioner Gary Edwards. We have County Manager Ramiro Chavez. We have our Director of Public Health and Social Services, Shelley Slaughter, our Thurston County Health Officer, Dr. Dimiana Abdulmalik, and the Clerk of the Board of Health, Lydia Hodgkinson, by Zoom, and Shelley and Dr. Abdulmalik by Zoom as well. For public attendance, we are now back to sort of our previous rules of engagement from a couple of months ago with respect to, I think it's 25% capacity within the boardroom, so folks can be present. And we have an overflow room if that's needed. We also have the meeting live streamed through our Thurston County YouTube channel, and a call-in for as a default, if that's the way you need to access the meeting. We do have that ability to do it through the number 360-252-9020, and then enter the PIN of 1234. So I'm calling the meeting to order here at 3:32. We are going to start with making sure we have an approved agenda. So is there a motion regarding today's agenda?
You're the Vice Chair.
Sorry, this is a new duty for me. Motion to approve the agenda.
Second.
Been moved and seconded. All in favor, say aye.
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 Aye. Motion carries and today's agenda is approved. We have meeting minutes from December 15th, 2020, special meeting minutes from before Commissioner Vice Chair Mejia was seated on the Board of Health. Is there a motion to approve these minutes?
Yes, I would move to approve the meeting minutes from December 15th, 2020, special meeting.
I will second that motion. All in favor, say aye.
Aye.
And I abstain.
Thank you. The motion passes 2-0 and the meeting, special meeting minutes are approved. Item number 1 on today's agenda is a presentation with respect to 2021 election of officers for the Board of Health. I'm going to ask Director Slaughter to introduce this item.
Good afternoon, Commissioners. This item is to appoint a 2021 Chair and Vice Chair of the Board of Health. RCW 70.05.040 states that local Board of Health shall elect a chair. That vacancy shall be filled by appointment within 30 days at the first meeting of the local Board of Health meeting. A chair shall be elected to serve for a period of 1 year. And I believe that the board has already made decisions regarding these appointments at the Board of County Commissioners, and so a motion is needed from the board to ratify that decision to elect your 2021 Board of Health Chair and Vice Chair.
Any questions or comments on this item?
No questions.
No, sir.
Is there a motion?
I move to confirm Commissioner Menser as Chair and Commissioner Mejia as Vice Chair for the 2021 Board of Health.
Second.
Been moved and seconded. All in favor, say aye.
Aye.
Aye. Motion carries 3-0. And that item, those appointments are confirmed. Next is opportunity for the public to address the Board of Health. And I will lay out some ground rules on that. The Thurston County Board of Health welcomes comments from the public at all meetings. However, there are some guidelines governing such comments to ensure they are appropriate and don't take advantage of the fact that most meetings are televised. When you're called, please introduce yourself, including your address or neighborhood or location in the county. Please address the board, not the audience or staff. Please silence your cell phone. The board does not respond to public comments at the moment, but there will be follow-up on an as-needed basis by the county manager or otherwise. Speakers are limited to a total of 3 minutes to address the board and may not donate any of that time to another speaker. The board reserves the right to restrict the person's opportunity to address the meeting for good cause. No comments that are lewd and offensive, inflammatory, hateful, defamatory, or discriminatory in nature are permitted. Please be respectful. No outbursts of any kind. or comments that are commercial in nature, such as promotion of a for-profit business. Materials that you submit to the county may be considered public records and subject to public release upon request pursuant to the Public Records Act under state law. And then remarks about pending land use permits or issues that could come before the board on appeal are not permitted. So thank you for your cooperation on that. We have 3 folks signed up that I've been provided thus far. So I'll start with them. We will allow virtual participation at the close of that. First is John Ptit.
Good afternoon, Board of Health members. I am John Ptit. I live out in East Olympia, Washington. My direction and thoughts are, I think that we need some clarity to certain things. I have mentioned before that I have a child who's a senior at Tumwater High School, and the entire aspect of a major portion of his life is being withheld from being able to be active within society. He's being withheld from being within the schools. Now, I understand as a Board of Health, you still have to follow direction, and you don't necessarily have authority to move things forward or necessarily overrule other sources. But I think for clarity about how things are, I think certain statistics about the Board of Health regarding COVID we need to bring out. I don't need to know all the numbers, but let's bring in the group of children like mine. I'd like to know how many children or people under 30 years old without other health conditions have died in Thurston County since COVID has started. Because this is the entire group of the schools that we're talking about. Now, I realize there's teachers. We all have to make decisions whether we're going to be able to participate or not. I want to know what's the actual effect. I do know that I heard about one possible COVID death of a teenager, but apparently it wasn't a COVID thing. It had to do with suicide. What a sad situation that we may be subject to, putting our kids in a state of mental despair that they commit suicide because we're not willing to let them participate in regular activities, normal, healthy, mental activities. Now, we need to do something stronger than just sit back. And I'm looking for the Board of Health to perhaps not try to just go with the 1 through 5 grades. High school kids are in the most tender moments of their emotional well-being. We need to get them back in school too. And so I'm going to encourage that. The other portion of my particular comment is we need to do something to correct. We have a health issue. We have a health issue of people that are along the streets that have mental health conditions that aren't getting assistance. We have people that have drug addiction issues that are not getting attention. Those are bleeding over into every other aspect of our community, and it's not safe anymore for people to even walk down the streets. I'm going to look to you as a Board of Health to see if you can take some action to force, and I hate to use that word force, but if people no longer have the capacity to make good decisions, then the Board of Health needs to step in and help them be directed and forced to get some good help. Thank you.
Thank you, Mr. Ptit. Next, actually, I'll give the next 2 names so folks are ready. Next is Sarah Overbay, followed by Stephen Manning.
Good afternoon, Commissioners. My name is Sarah Overbay. I am a mother of 6, and I live in the Tumwater area. I'm here again to ask your help in holding our health officer accountable for following the Washington Department of Health guidance that was issued for school reopening over 27 days ago. On December 16th, Governor Inslee released updated metrics that recommended schools reopen for phase-in in-person learning for grades kindergarten through 5 at any COVID activity level. Even if our county were to jump considerably in transmission rate, schools were still recommended to begin reopening. On January 5th, our health officer released a letter to area superintendents that she wanted to monitor our COVID activity for 3 weeks, and that if we stayed in moderate range, then she would recommend starting in-person learning. Again this morning, she reiterated that continue to watch and wait policy, ignoring the fact that our schools have been cleared to reopen for almost a month. In response to this delay of recommendation, Olympia and Tumwater school districts both released statements to their families that they were waiting for this authorization from Dr. Abdamalik to proceed with reopening plans. The statement was made this morning that it is not if schools reopen, it's when. This is a decision that needs to be left to the discretion of the school districts. The watch and wait approach by Dr. Abdamalik cost us the ability to open in September when rates allowed. It forced schools to pause hybrid this fall when several schools were operating successfully. Now this is continuing to handcuff our districts who should be releasing reopening plans. Backed by science, Governor Inslee's team at the state reissued guidance and affirmed that school buildings can be safe. Further, the school year is not indefinite. Opportunities to intervene with students are numbered. Knowing all this, local pediatricians have been urging the county to recommend schools reopen now. Districts in Pierce, King, and other counties are releasing reopening plans, including all grade levels. Our state has answered the question of when schools in our county were able to reopen, and it was December 16th. The State Department of Health has given the schools everything they need to know about when and how to reopen and the authority to do so. Please allow them to do as they see fit. There is great work here to be done in public health with vaccine distribution. Please focus your efforts there and allow school administrators and their teams to execute their reopening plans. Thank you.
Thank you, ma'am. Next is Stephen Manning, and then we will, I don't know who's up next because I
Yeah,
don't know.
we have another member of the public here in the room, Commissioner.
Okay, well then he'll probably, he or she would be next then.
Yeah.
We'll go to the Zoom.
My name is Stephen Manning. I'm a resident of Olympia and father of 3 children. In Dr. A's January 5th letter, she requires 2 things before opening schools. First, Thurston County must continue to stay in the moderate transmission range for 3 weeks. Even though the county is already in the moderate range, and even though the county should already have kids back in school, according to BoH, Dr. A requires an additional 3-week waiting period. This is absolutely contrary to the guidance from the state. Thurston County currently has a transmission rate of 239 per 100,000 residents. We are well within the moderate range, yet we have to wait an additional 3 weeks, according to Dr. A. Her second requirement is that there must be sufficient testing, hospital, and public health capacity. Again, Dr. A is adding additional requirements that are contrary to state guidelines. These state guidelines were clear. If a county is in the moderate range for COVID-19 activity, a careful phasing in of in-person learning is recommended. Even if a county is in the high transmission range, in-person learning for pre-K through 5th grades are to be phased in. Simply put, Dr. A's January 5th letter is the very definition of arbitrary and capricious government action. It is willful and unreasoning and without regard to the state guidance. Further, the latest DOH guidance says that the local health officer should advise the school administrator and the school community on the level of COVID-19 activity. I want this board to review all of Dr. A's letters regarding distance learning. Do you really think these letters are merely advising school administrators on COVID activity? Although Dr. A only recommends that our actions be taken, Olympia and Tumwater school districts have stated that they will only follow her recommendations. She holds significant authority in the county. The board should ask itself, are her actions even consistent with state law? RCW 7005-070, subsection 3, states that the local health officer should control and prevent the spread of dangerous, contagious, or infectious disease. But the latest recommendations from DOH state that with appropriate mitigation techniques, the spread of COVID-19 has been limited in the school setting. If the spread of COVID-19 has been limited in the school setting, what is it that Dr. A is seeking to control and prevent? How can DOH recommend a phased return to in-person learning, even in high transmission counties, but Dr. A currently won't recommend the same in a county with moderate transmission? Under what authority is Dr. A acting when she recommends the necessity of an additional 3-week delay? It has been 27 days since the state recommended returning to in-person learning. As of today, Dr. A recommends 10 more days of delay before she even looks at the figures again. These arbitrary delays are without merit and must stop today. Thank you for your time.
Thank you, sir. I don't know who's next up in line.
Yeah,
I'll let
please,
the
please come.
manager.
Yeah, please come. Please introduce your name, where you reside in the county. You have 3 minutes.
Thank you. Hi, my name is Casey Taylor, and I live in Thurston County. I come to you today as a longtime resident of the county. My father first came here in 1974 and was originally employed at the Little Rock School. That was before it became part of Tumwater School District. So I was around in the 80s, and I saw a crazy sheriff take down a criminal one day. It was on the newspaper, and he's right here, and he's a pretty good guy. So I've been in the area a little while. I also work for the Department of Health. Worked on the incident management team for 5 months during the summer at the Department of Health. I'm also a parent of a kindergartner, excuse me, and a senior in high school. Yes, I know how that works. Quite a diversity there. I've seen quite a bit. I've also happened to be the vice president of the Tumwater School District School Board. So I'm coming here today to echo what Mr. Manning said and what Mrs. Overbay has said. I think we need to give the choice to the parents whether they want their kids to be in school or not. I think the metrics and the guidelines have changed. You've hampered school districts' decision-making capability. The Thurston County Health Officer metrics do not help our decision process. They're causing anxiety and stress among parents in their work schedules, daycare schedules, in students in their activities, in teachers and staff in their careers, daycare for themselves, and also their own work plans. It's also causing me some stress and anxiety as well too, but I'm here to represent these people. I would like to see the Thurston County Health Officer commit to a date and work with us in a partnership to meet that opening. The current process does not add value to our decision-making process to return to school. It basically confirms what we already know, and we have to make plans to do what's best for our children. Again, I would like to reiterate what Mrs. Overbay said to Mr. Manning. Those are the 2 types of emails I get from parents that have exact concerns about this. In fairness, I do get concerns about teachers that are concerned about returning to a workplace. That's a valid concern as well. And I'd like to finally address that concern in vaccinations. Get this staff and teachers vaccinated, please. It's a must. Don't just do the teachers. Don't just do the bus drivers. Please vaccinate everyone as soon as possible. That measure alone will help us in so many regards that there's a commitment to that. But please, I'm here to advocate for them, to move them up in the schedule, or for the Thurston County Health Officer to please advocate for that as well too. We understand safety is a concern, but thank you again for listening to me today. Sorry about this. I'm usually on the other end listening. And so again, thank you very much, Board, and thank you, Mr. Edwards, for your service. I appreciate it.
Thank you, sir.
Thank you, sir. Let me go to the Zoom meeting. I think we have 1 member of the public, and then I'll move to the conference call.
Thank you. Ms. Longworth is back.
The only one that I have on the Zoom meeting is Ms. Reyna Longworth. Can you please unmute yourself, state your name, where you reside in the county? You have 3 minutes.
Hi, good afternoon, commissioners. My name is Reyna Longworth, and I live in Tumwater, Washington. I'm also a mother to 2 elementary-aged kids, one who is in a kindergartner, who still 4 months into the school year has not even met a single student from his class in person. Last month, the governor and the Department of Health set out new guidance for school openings. If the county is in moderate range, which is below 350 cases of COVID per 100K, elementary-aged kids need to be back in school in a hybrid model. My boys were so excited when they heard this. Then last week, Dr. A releases a statement adding additional restrictions before she can recommend for schools to open. Why is that? when every pediatrician, virologist, CDC, the government, and Department of Health have clearly stated kids need to be back in school? Why is she jeopardizing our kids' education and social well-being? Why? So many other districts and states have gone back to school full-time with the safety protocols, and students are thriving and teachers are in class doing what they love. Private schools in Thurston County have been back full-time since September without any issues. Why are our kids still sitting behind computer screens and haven't even met their classmates in person once yet this year? And we're 4 months in this school year. Why? I'm here as a concerned mom to ask for the Department of Health to look at these recommendations and revise them and get these kids back in school. Don't be the only health officer who is withholding this school experience from children for absolutely no reason. Listen to science and open up the schools. Thank you.
Thank you, ma'am. I don't have anybody else on the Zoom. Let me go to the conference call. Let me see if I can do this. Good afternoon. For those members of the public who first of all, those members of the public who have joined us via conference call, please mute your phones until I can call you. Please, because there's feedback if you don't do that. So members of the public who have joined us via conference call and would like to provide public testimony in front of the Board of Health, please unmute yourselves, introduce your name, where you reside in the county. You have 3 minutes.
Hello, my name is Laura Matson. I'm a parent of a sophomore at Olympia High School. My purpose today is to speak not for one, but to advocate and be a voice for hundreds of students and parents that are fearful of speaking due to their jobs, may not know how to speak, or have just given up. The ask today is for you to share your science and why you continue to keep schools closed and have no plan in place for high school to start in the near future. On November 17th, Commissioner Edwards asked Dr. A several valid questions on why schools continue to be closed. Question 1 was, private schools are open. Can you share the outbreak of cases there? Dr. A reply is, I cannot. There's a stigma in sharing, but there are cases of outbreaks. I find it interesting you say there is a stigma, as wouldn't the general public need to know, and wouldn't this fall under contact tracing? In addition, it has been enlisted in several local newspapers in regions outside of Thurston County of when a school has had an outbreak. Question 2, Commissioner Edwards asked, what is this doing on the mental health of our students? Dr. A replied, that's a good question. I've been trolling for the data. What Dr. A apparently failed to remember is it was just a week before where she is given data by local parents that the suicide rate for children 8 and older is increasing. Over the last couple of years, it averages about 3 to 5. Since March, there have been 15 cases. Dr. A, you stated in June your concern of MIS-C in students. In the whole state of Washington, it appears there are 15 cases statewide as of October, yet you have 15 cases of suicide just in Thurston County. One death is too many, but your science is not matching up to your actions of withholding kids to be in the classroom. The Center for Disease Control and Prevention reports that 1 in 4 people ages 18 to 24 have suicidal thoughts, and the proportion of mental health related ER visits among 12 to 17 is up by 31%. It didn't take much to troll for the data to show the mental impact on students, and this doesn't even begin to touch on the physical and academic impact. Thurston County Health Department is withholding schools from opening, and it is not an equitable situation for the students in our area. The long-term effects of the physical and mental stability of our kids is being witnessed now, and yet the science behind schools being closed is vague. Center for Infectious Disease Research and Policy shared 3 different studies that demonstrate there is a low COVID risk of in-person school. Meade, East Valley High Schools, to name a few, have few kids in the classroom. Yes, there have been COVID cases, but school administration made adjustments as needed. In the spring, Ms. Slaughter says the likelihood of kids being back in school would not happen until a vaccine is in place. In December, Washington State received vaccines, and yet 30% has only been distributed. BoH has had months to put a vaccination program in place, and yet you are falling behind within just 1 month. COVID is real. No one denies this. One death is too many, but the consequential problems for over 10,000 students and their families is devastating, and that is just in Thurston County. Please share the true science of why you insist to keep schools closed. Your fact gathering has gone on way too long. Our kids need hope. They need their future. And as I listen to this meeting, an email just appeared of schools opening late February and March for all students. My ask is to please keep this commitment to our students. They are our future, and they need us. Thank you.
Thank you. Please mute your phone. Is there anybody else who have joined us via conference call who would like to provide public testimony? Please unmute yourself.
Hi, my name is Rebecca Cornelius.
Go ahead.
And thank you.
Where you reside in the county, you have 2 minutes.
I'm sorry?
Please state where you reside in the county and you have 3 minutes.
Okay, thank you. Yes, so my name is Rebecca Cornelius, and I reside in West Olympia. I appreciate the time to speak this afternoon. I am a parent of 2 students in Olympia School District, and I'm also very active in schools of volunteering and being active on the PTOs. My son is a senior and has become very withdrawn social, emotional, and educationally. With his disability, I have seen him regress, and I'm highly concerned for his success when he graduates because of this regression. I also have a daughter who's in 7th grade and went from loving school and excited to learn to bored, disengage, and is withdrawn from classes, teachers, and peers. I'm speaking today in favor of opening our schools back up for students to return to hybrid models at the very minimum. When you review the COVID-19 risk assessment dashboard, the average 14 days, which was updated I saw last night, showed 239.7 cases over a 14-day average. That is well below the moderate level listed on the Department of Health's website in their tree. I'm not understanding why we can have private schools open for in-person learning, why we can have white care and boys and girls clubs in our schools. And I keep reading and hearing and speaking to other people in other districts among the state of Washington and in other states where they are reopening or have set firm dates to reopen. It is not clear why our schools here in Olympia, Washington cannot get back to in-person learning. The Thurston County Board of Health has a significant influence, especially with Dr. A and our superintendent. And I feel that right now, we keep saying that we're going to wait and see is not getting us anywhere. We wait, we see the cases go up, we wait, see the cases come down, and there's still no change. And all I'm seeing day in and day out are my students and my family students and other peers and parents struggling to support their students both socially, academically, educationally, in every fashion. I truly believe we need to support and get our kids back in school, in learning, or excuse me, in-person learning. Thank you.
Thank you. Is there anybody else who have joined us via conference call who would like to provide public testimony this afternoon? Please unmute yourself, state your name, where you reside in the county. You have 3 minutes.
Hi, I'm Tracy Ross, and I reside in Thurston County. I am a parent of a junior at Tumwater High School, and I'm also a teacher in person at a local private school. We have been in person since September, and we have had 0 spread since then. We've had 2 students quarantine when their parent tested positive, 1 teacher quarantine when he was in close contact. We've been following every mandate to mask, to social distance. We have barriers. We've been using all the protocols to stay safe. I have never been afraid to teach or come to school because we know it's possible. It's possible to make this work.
Has left the conference.
Yet in remote situations, things are totally opposite. Kids are failing, they're depressed, they're losing hope and motivation, and I have to ask, why are we not weighing those health concerns with the same as COVID? I know COVID is real and we need to take it seriously, but there are ways to do that while also providing for the mental health, the physical health, emotional health of our students. Many of my friends have kind of lost their students during this time, students who have dropped out of school, a friend whose student is physically hurting himself because of this. And so, and as Mrs. Mattson said, the suicide rates are just skyrocketing as a result of this. So again, why are we not looking at that and the health of our students? Every doctor that I talk to and ask, they believe that schools are safe. They believe that they can operate. Schools that have been open across the country have shown very little risk in being back in person. And so I feel like the masking, the social distancing, it's working. And we need to look at that. We need to look at the positive data of what's working in schools and open as soon as possible. I think that second semester for, early February could have worked had we put in place a plan when we were allowed to back in November and December. Now, I believe we need to stick with a middle of February date at the latest for our all grades. High school students are suffering just as much as younger students, if not more, and we need to get them back in school. Please do not cave to the news sources that perpetuate fear, but be strong and do what's right for our students. Thank you very much.
Thank you. Is there anybody else who would like to provide public testimony via conference call? Please unmute yourself, state your name, where you reside in the county. You have 3 minutes.
Hi, my name is Katie Manning. I have 3 kids and I live in Olympia. I wanted to speak before the board and Dr. Abdumalik to ask for clarification, as I was surprised and perplexed by her letter on January 5th. I felt confident after our governor spoke in December and after reviewing the updated state BoH guidelines that we were finally on a path to returning our students to the classroom where they need to be. That confidence turned to confusion as I read Dr. Abdumalik's recent letter. Why is she recommending a 3-week delay? I understand there is concern about transmission rates after the holidays, but BoH, even with a county with high COVID activity, which we are not, recommends in-person learning for pre-K through 5th grade, which we are, the delay Dr. A instituted is clearly counter to the recommendations by the health department and oversteps her authority. I can find no other county requiring such steps. In fact, in Pierce County, which has significantly worse statistics, schools are quickly sending students back to school. The latest statement I can find from their health department says, and I quote, "We support school districts and private schools as they plan to implement a safe return to in-person learning for all students." Dr. A also references testing, hospitals, and public health capacities in her letter without providing any specifics on measurement of these metrics. The Department of Health states, and I quote, "The local health officer should ensure information on key indicators is available to inform school administrators and the public." Again, I cannot see where this is happening, and Dr. Abdumalik is falling short of what she is obligated to provide to our communities. The same day that Dr. Abdumalik released her letter to the community, she released a provider alert to physicians and others entitled "Increased Concern of Suicide Risk to Youth During COVID-19. This advisory says in part, the rise in suicide is because of, and I quote, "disruption of academic years, economic impacts, and social isolation," end quote. I can't be the only one to see how contradictory these 2 documents are that were released the very same day. Again, I quote the Department of Health document from December 16th, which says, "While cases and outbreaks do occur in schools, recognition of transmission of COVID-19 has been limited in the school setting," end quote. If we know that transmission is limited in the school setting and we know that our students' emotional health is failing, why are we not doing all we can to open schools right now? The Tumwater School District and the Olympia School District, as you have heard, have both put out written statements to their families they will not return without doctor's recommendation. I am asking that the Board of Health work with Dr. Abdumalik to reconsider the statements made in the letter of January 5th. Untie the hands of the districts and let students return to the classroom safely. After all, the classroom is sometimes the best place for adults to monitor students' emotional health. Leaving them home alone to stare at a computer screen is not a solution any longer. Thank you.
Thank you. Is there anybody else who would like to provide public testimony this afternoon via conference call? One more time, is there anybody who has joined us via conference call who would like to provide public testimony in front of the Board of Health? Please unmute yourself. You have 3 minutes. Not, sir.
Thank you to those who called and came in to provide public testimony today. We're going to move to item 3, which is a consent item related to special meeting work session notes for board briefings. These relate to briefings on September 16th and November 4th of last year. So there would likely need to be a motion from Commissioner Edwards on this.
Yes, sir. I'm prepared if you are ready, sir.
I am ready.
I would move to accept special meeting work session notes for briefings on September 16th, 2020 and November 4th, 2020.
As Commissioner Mejia, Vice Chair Mejia was not on the board at that time, I will second this motion. Any further discussion?
No, sir.
All in favor, say aye.
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 I abstain.
Okay, that motion passes 2-0. Those work session notes are approved. We move to item 4, which is a department item, a vaccine presentation. We have Dr. Abdulmalik and Shelley Slaughter. I'm not sure who's going to lead off with this, but that's with you.
Thank you so much, Mr. Chair. I will introduce this item, and Dr. Abdulmalik will be leading this presentation, and then we will be available to answer any questions that the board has at the conclusion of the presentation. The focus of our presentation today is vaccine planning, but we will also provide information as a follow-up to the board's request for information on COVID-19 national and local incidents, as well as data on morbidity and impact, long-term and short-term health impacts of those who have experienced COVID-19 thus far. And so with that, Dr. Abdulmalik, will you please share your screen and begin the presentation?
Good afternoon, Commissioners and Board of Health. I wanted to present a little bit to you today, both in response to questions we've received about the impact of COVID-19, as well as information on the COVID-19 vaccines available and the planning that has gone on in terms of our Thurston County specific response. So just to back up a little bit, thinking about what is COVID-19. COVID-19 is a viral respiratory illness caused by the SARS-CoV-2 virus. It's spread primarily through droplets, respiratory droplets, and close personal contact. It can also be spread through touching an object or surface with the virus on it and touching your mouth, nose, or eyes before washing your hands. Although, close contact and respiratory droplets are definitely the way it's believed this disease is primarily spread. There's a wide range of symptoms, so cough, shortness of breath, and high fever or chills are some of the more common symptoms, but folks also get muscle aches, body aches, vomiting, diarrhea, and the pathognomonic symptom, new loss of taste or smell. Pathognomonic just means that this particular symptom correlates very, very closely with COVID-19 disease. So we'll continue on a little bit more. So how do we prevent COVID-19? So maintaining 6 feet or more of distance between ourselves and non-household members, wearing a mask in public, not touching our eyes, nose, or mouth, respiratory etiquette, enhanced cleaning, and essentially staying home when we're sick or when we're instructed to by public health, as well as all of the copious hand washing. So thinking about who is getting sick from COVID-19. So the incidence rate is highest in younger adults, and this is national data from the CDC. There is a bump in the 85. There is a bump in the 85 plus category, likely due to the disproportionate number of folks 85 and older in congregate settings, which are an additional risk factor for contracting the disease. However, mortality, as we all know, is highest in the elderly, although as you can see, there is mortality across the board resulting from COVID-19. Mortality isn't the only measure of disease severity. What we have learned in the recent months is that there are long-term symptoms for some individuals. The most common that the CDC has noted are fatigue,
shortness of breath, cough, chest pain, and joint pains. Less common, but also reported, difficulty thinking, depression, muscle pain, headaches, fever, as well as a number of folks who've had COVID-19 report having a pounding heart rate, and it can be sustained or it can be intermittent. In terms of long-term complications that the CDC has identified, there have been folks that have cardiovascular complications, meaning that the heart muscle and in some cases the sac that surrounds the heart has become inflamed. Of course, there's lung function abnormalities due to inflammatory processes as well as a result of the disease. There have been injuries to the, kidney injury is not uncommon. There have been rash and hair loss associated with this disease, in addition to neurological and psychological long-term complications, including persistent loss of taste and smell, difficulties with sleep, difficulties with concentration and memory, as well as changes in mood, depression, and anxiety. So we've talked a lot about, why is it that so much effort has gone into mitigation measures, and an unprecedented amount of effort has gone into mitigation measures across the US as well as in Washington state. This is the CDC data on excess deaths of, going back to 2017. And you can see that starting in about April, we start to see significant excess deaths across the country. These deaths reflect not only deaths from COVID-19, but also deaths from other causes. Because when a health system or a society becomes overwhelmed by COVID-19, other folks with different health problems may have delays in accessing care, delays in timely care, and challenges in resource allocation. To date, based on the CDC's most recent information, there have been 375,124 deaths directly related to COVID-19. In Washington state, we have been successful with mitigation measures. So the distancing, the masking, the governor's most recent trajectory changing restrictions have all played a role in limiting the number of excess deaths in our state. You can see that when our transmission rates have most recently climbed in that November-December period, we did see a significant spike in excess death rates. So in Thurston County, where are we at? So as of January 10th, 5,456 folks had been diagnosed with COVID-19. We had a total of 58 deaths, and 322 individuals had been hospitalized since the pandemic began. We have had multiple outbreaks in long-term care facilities, with 4 that we're currently working on as a department. A different way to look at our county situation is to look at that rate of cases per 100,000 over the preceding 2 weeks. And this is the state's data from last Friday. So we can see the significant spike in transmission between September and October, and then that almost exponential curve between the end of October and beginning of November, which brought us to our highest transmission rate ever of 279 cases per 100,000 over 14 days. We are continuing to closely monitor our cases in the county. Last Friday, we reported the largest number of COVID-19 cases that we have since the pandemic began of 133, and we're continuing to watch closely.
So when we look back and we look at, when our specific spikes have happened, they do tend to cluster around holidays. So there's the 4th of July holiday that led to our first bump throughout the month of July and August. Then Labor Day set off another spike. And then as folks moved indoors during the winter months in the beginning of November, we started to see the spike that we're currently in. So hope is on the horizon. There are 2 approved vaccines. They are both mRNA vaccines, meaning that they have that there's a small snippet of genetic instructions that are encased in a lipid layer that allows cells to take it up. These instructions then get read in the cytoplasm of the cell, and the cell will make protein, and the body recognizes this protein and mounts a defense against it. Both of the vaccines that are currently available, the Pfizer and the Moderna vaccine, are effective, so 94 to 95% effective. The Pfizer vaccine requires ultra cold storage in terms of -80 and -60 degrees Celsius, and has 2 doses 21 days apart. Moderna requires freezer storage for 6 months, but it can be kept at refrigerated temperatures for 30 days, and it involves 2 doses 28 days apart. The Pfizer is approved for individuals 16 and up, whereas Moderna is just for adults 18 and older. At this time, vaccine is our best hope to help end this pandemic. So we are strongly encouraging everyone to, when their time comes up, to get the vaccine when it's available. There are specific allergies or conditions for which you may not be eligible for vaccine. The absolute contraindications involve allergies to specific vaccine components. We have seen some side effects during the rollout of vaccine, both in Washington State and across the country. The most common side effects are sore arm, fatigue, headache, and muscle ache. Some folks have reported fever. The vaccines are available at no cost. So the cost of the vaccine itself is fully covered by the federal government. However, and the vaccine administrative fees may be covered by insurance. And however, there should be no vaccine administrative fee charged to those who cannot pay or do not have insurance per the Washington State Department of Health. There are things that we know and things that we don't know. So we know that the vaccines are effective at preventing COVID-19 disease. We don't know whether or not the vaccines will prevent the spread of SARS-CoV-2, which is the virus that causes COVID-19. So meaning that we are still learning whether or not those who are vaccinated have potential to be asymptomatic spreaders. Masking, distancing, hand washing, all of the staying home when sick and staying home when instructed by public health that one has been a close contact remain the backbone of keeping our society safe. And I look forward to a time when enough folks are vaccinated and we know enough about the vaccine strengths and limitations that we can, with the guidance of the CDC and the State Department of Health, roll back some of these preventative measures. But that time is not yet. We are going to be continuing these mitigation measures for a while. So vaccine at this time the supply is limited. However, we anticipate a time when there will be more than enough supply, and everyone who wants the vaccine is able to get it. So there is a phased approach that Washington State is taking in concert with the rest of the nation. It's informed by the CDC Advisory Committee on Immunization Practice. And then there's a local component decided by the Washington State Department of Health in conjunction with local advisory groups. We are strictly following the Washington State Department of Health phase guidance. So in terms of the criteria that folks are looking at to determine who would be eligible in what phase, it looks at the risk of acquiring the infection, the risk of getting severely ill or even dying if one gets the infection, the risk of negative societal impact if a specific sector or group was disproportionately affected by COVID-19, and then the risk of transmitting infection to others over the course of one's work or one's living situation. So we're starting with those at highest risk of getting COVID-19, as well as those who have the highest risk of severe illness. This is the timeline that was recently released by the Washington State Department of Health. We are currently in phase 1A. Phase 1B is the next phase, and it's broken out into 4 tiers, which I will get to later. This is a schematic of what we anticipate given current supply of vaccine. However, as more vaccine becomes available, I do anticipate that the specific timing will change. And it is our goal as well as our state's goal, and I know that it's the goal of our federal partners as well, to get as many people vaccinated as quickly as possible. So taking a closer look at phase 1A. So we are currently in phase 1A, which includes high-risk healthcare workers. So it's split out into 2 tiers. Tier 1 is high-risk healthcare workers, high-risk medical first responders, and individuals who work and live in long-term care facilities. Tier 2 is all healthcare workers. In terms of phase 1A, facilities are currently dispensing COVID-19 vaccine. They have to enroll as COVID-19 vaccine providers with the State Department of Health. And allocation for vaccine comes from the State Department of Health with input from local health jurisdictions. There is a separate federal process through CVS Walgreens through a partnership with that corporation to vaccinate residents and staff at long-term care facilities, and that process is already underway. In terms of what we're doing as Thurston County Public Health and Social Services is we're providing reliable information to our community, and we are working to ensure equitable access to vaccine supply for everyone eligible, as well as facilitate coordination between local partners. A major part of this task is in assisting individuals in phase 1A who are enrolled providers to access vaccine through a voucher process. So at this point, folks can go to our website, and if they are employers of 1A staff, they can download a form, list their 1A staff, submit that form to us, and they will be given a set of instructions of how to get a vaccine from providers that have the capacity to vaccinate unaffiliated 1A members. And we are working to expand that vaccination capacity. The other piece of our job is to connect unenrolled long-term care facilities with pharmacies who can assist with vaccination. And this includes looking at pharmacies that operate within our county who have capacity to help provide similar end-to-end vaccine provision, similar to the Walgreens CVS model. Additionally, our role as public health is to help fill those vaccination gaps. So where there's a need, working both as an intended vaccinator ourselves, as well as partners who are also intended and practicing vaccinators. Phase 1B was announced on January 7th by the Washington State Department of Health. It involves a much larger group of folks that will need to be vaccinated. I'm going to go into that on the next slide, but essentially it divides folks into groups based on risk. And this was done to preserve flow through the vaccination process. So this is probably the first time where you'll see that Washington State differs a little bit from the CDC. And the reason why that was to ensure that we had the capacity to vaccinate folks in phase. And so sometimes when a system is overwhelmed, it's harder and more inefficient to get folks vaccinated. And so that's why phase 1B got broken out into four tiers to ease that vaccination process. So it's so there's priority order based on risk, starting with the health risk of folks that are older, and then followed by risks undertaken by folks in essential work. But there's a little bit more to come on that in a slide. We anticipate, so right now, Thurston County Public Health and Social Services is doing the voucher program and working a lot by hand to connect people with vaccine. We anticipate that Phase Finder will be released by the State Department of Health in the coming weeks. And this will allow individuals, and this will be absolutely crucial in Phase 1B, to determine what phase they qualify for. There will also be a link to Vaccine Finder, which will then connect folks to where vaccine is in their community. And this will allow folks to schedule appointments for vaccination. Our role as public health continues to provide reliable information, ensure equitable access, work on that coordination piece, as well as promote and support vaccination events that are ongoing in our county. We will be providing multiple vaccination sites, a static site, and have plans to start mass vaccinations early February. We will also be participating in mobile vaccination clinics as well, targeted to specific groups in phase that may have difficulty accessing vaccine through other means. So thinking about Phase 1B, so Tier 1 really looks at folks that are 70 years and older, as well as people who are 50 years and older in households with two or more generations. We know that household spread is a significant driver of COVID-19 risk, and we know that folks age 70 and older are at increased risk of severe illness, hospitalization, and death from the disease, which is why they're Tier 1. The Washington State Department of Health looked at critical infrastructure workers, and due to projected supply, broke them out into two groups. One is the critical infrastructure workers 15 years and older that work in congregate settings. So we're thinking congregate agriculture, congregate food processing, grocery stores, corrections, law enforcement, and of course, those who work in our schools, teachers and staff, as well as those that work in childcare. The under 50 group will be, it falls under Phase 1B Tier 4. Tier 3 includes people 16 years and older with 2 or more comorbidities or underlying conditions, and these are listed on the CDC website, including COPD, including obesity, type 2 diabetes, and immune suppression, and recent transplant. Tier 4 means the vaccination of critical infrastructure workers under the age of 50, as well as people in congregate living situations. So corrections, prisons, detention centers, as well as individuals experiencing homelessness that live in congregate settings. So shelters and temporary housing as well. So Tier 4 will rely on multiple partners, including ourselves, to get folks vaccinated. Looking beyond phase 1B. So as we've seen, our state creates our phases based on our local population and constraints in alignment with the CDC guidance. We are at a point of significant change in our country, and so there may be changes in phases and the approach based on vaccine supply, as well as decisions made at the policy level. Some things that absolutely won't change are the continued focus on equity that we have here in Thurston County, and our focus on ensuring that everyone in our county has the opportunity to get vaccine as quickly and as efficiently as we possibly can make that happen. We're looking at scaling up larger scale vaccination sites at both permanent and potentially temporary locations. We're looking at working with specific groups. So once we get into 1B2, we're looking at different groups by occupation. So really what we're trying to do is find those with the highest need and the least access in each of these groups and support those efforts in addition to other organized efforts that are occurring in our community. We do need volunteers and providers. This happens through our Medical Reserve Corps. People who are interested in joining our Medical Reserve Corps can access that information on our county website. You can also access our county website for the latest information and updates, both on COVID-19 in our county, as well as our vaccine process. And with that, I would like to say thank you and open it up to any questions.
Okay, thank you. I know I have several. I don't know, maybe we might want to go around the horn kind of, but I'll just start with Commissioner Mejia, or I'll start with Commissioner Edwards. And Commissioner, I don't know if you've got a lot of questions, maybe we just go around robin, or if you just have a couple, we can do yours and then go to the next commissioner.
Oh, okay. I've got several, but I'll keep it short. I've been staying in touch with the private schools, and I find no problems in private schools and the operation of the private schools. Now, I'm not going to say that there is nothing going on or they haven't had a problem, but none that I've been made aware of. So I'm trying to understand why we've got young people out there that are not following any rules. When I say young people, young teenagers and such, sure, 5, 6 years old, they're gonna do what mom says possibly and be isolated. But these other kids are gathering and they're not following any rules. Why can't we put them into a school setting where they'll probably be safer and less likely to transmit any problem? So I'm trying to take into consideration what we heard from citizens here tonight that are all parents that I'm aware of, all very concerned. And can you give us a overview of answers? Maybe you were sitting through their concerns, you've heard their concerns. Can you address some of those issues as to why we can't open up our schools and get back to some normalcy, because we're going to continue to suffer if we don't get back to normal? And I could go on and on and on, but I'd like to have you at least address the concerns that these citizens have brought forward. And why not? I mean, especially, I can't find anything wrong in private schools, so maybe if you could just focus on that. Why can't I find anything out of whack in private schools? And if I can't, why can't we get back into school?
So I'd like to preface my response by saying that here in Thurston County, we are in agreement with the governor's most recently released guidance, and we are working with our local school officials to expand in-person learning opportunities in agreement with that stated guidance as a county in moderate transmission. So with that, I do support a safe and cautious phased-in approach to learning in agreement with that particular guidance. The issues that we run into when we look at the schools and have been running into for some time, as there have been small groups of students in our schools since the beginning of the school year, focused on those with the highest needs, as well as our private schools, as you mentioned, have also been running. As community transmission rates go up, there is exactly as you would expect, more cases in the schools, and that excess and that extra capacity and the capacity that's needed, and the cooperation that we all need to have as a community, both to keep transmission rates at a moderate level, as well as the cooperation that we need to have with our as school communities is essential, because really keeping schools safe relies on not only the mitigation measures, and the governor and State Department of Health have put out great guidance in the last December on that, as well as folks staying home when they need to quarantine, staying home when they're sick, and getting tested. We have seen cases, and we have worked with schools of both public and private persuasions since the pandemic began to work on mitigating risk. And as we look at having more students in schools in agreement with the state guidance, this will be a significant effort that we at Public Health and our schools and school districts will be sharing, and that we will be sharing with our families and teachers and staff as we work to keep our schools as safe as we possibly can.
I'm trying to follow the rules. So
I appreciate that, Commissioner Edwards. Let me ask Commissioner Meehan. We'll circle back to you because I have several things I want to touch on, but we'll just go one at a time. Commissioner Meehan.
Okay, I guess since we're asking one question at a time, I'll ask for clarification on what you're actually recommending, Doctor. I read your letter that you sent, and ending, you said, I will recommend. So maybe there is some confusion there with the schools where you're not, that will, it puts it in future tense, and that's why the schools are probably not wanting to open, or they're waiting for your, for the green light from you. So, I want to know, did you already recommend for schools to open, or are you going to recommend? Can you please clarify on what you actually are recommending schools to do?
So in terms of my current recommendation is that schools engage in planning for reopening at the level, at the transmission level that we're in after we see the impact of the most recent winter holidays. In the past, we've seen that be a 3-week period before we know the level at which we're going to plateau at. And it's not a question of if schools reopen, it's a question of when schools reopen, and whether we need to follow the state guidance on the high transmission precautions, or the medium transmission precautions. So that's one big thing. The other piece is, so keeping schools safe also relies on public health capacity, hospital capacity, as well as trends. And this is actually codified in the guidance, in the written guidance itself. Some changes in this guidance are easily operationalized, but I know that a lot of us who have been in school, and I include myself having been in school a good long time, some things do take time and processes to put into practice. So the state guidance made a decision that that small groups, the change in definition from 6, which we had been using from 5 previously, is now 15. That is currently in effect at this time, in agreement with the state guidance. In terms of opening entire systems of schools, we're looking at transmission rates. We're looking at how at what we can reasonably expect going into spring. But I will say that Thurston County will be, is on the path and is in alignment with the governor and State Department of Health's guidance on this.
Commissioner Mejia.
Do you mind if I ask a follow-up question, Chair?
Yep.
I'm sorry, but I'm confused with your answer. I'm not a scientist, I'm not a doctor, so can you please break that down? Is just because I mean, I went to this other school districts, Snohomish, King, Pierce, Whatcom County. I've seen all their plans for hybrid, distance learning, full-time remote learning, and just seen all of that. So if you can just please break it down in a way where, are you recommending for schools to open cautiously, of course, with a hybrid model, or are you not, or are you going to make a recommendation at a later date?
So at this time, I know that my colleagues are engaging in a lot of preparation with this new guidance. If we are in the moderate transmission range in 3 weeks from New Year's, I will recommend cautiously phasing in of a hybrid model of education for elementary and middle school students in agreement with the guidance put forth by the Department of Health, provided that we have all of the ancillary pieces and capacity to make sure that those who work and learn in our schools are safe.
Thank you.
I'm going to go in the order of your presentation. So hopefully this is a really quick question. Your slide that talked about the long-term effects of COVID-19 short of death, are those effects distributed across age groups evenly, or do certain age groups suffer from, like enlargement of the heart? I brought up that Ohio State student athlete study. I mean, is that something that's hitting younger people, or that's just hitting everyone? And all those different long-term effects, how are they affecting people by age? Is it even across age, or are some of those long-term effects age specific?
So that's a really good question, and it's a complicated question. So what we do know is that individuals, even young individuals who get COVID-19 and aren't hospitalized, can have long-term sequelae, meaning long-term symptoms. So cough, fatigue, shortness of breath. This is in the 18 to 35 group that the CDC studied. So part of the difficulty in answering the question is that there's a patchwork of studies looking at different pieces of it. So in terms of having a cohesive population model for this, we're still a little early in the game. People are still looking at specific populations. But what I did want to reinforce was that for young people, even those who aren't hospitalized do have can have long-term symptoms, and that we're not, and that these symptoms are likely due to the result of inflammation from COVID-19. We are seeing, recent studies have come out about seeing, changes in the brain after COVID-19 infection, leading to some of the psychiatric sequelae that we're seeing. We're seeing, MRIs looking at, enlargement of the heart and some swelling of and inflammation of the heart muscle. We are looking at gas diffusion studies of the lungs. So not just do the lungs look structurally the way they should, but are they actually exchanging oxygen and carbon dioxide the way we would expect them to be? And we are seeing changes across all of those parameters. It's still a little bit so a lot of this hasn't been formally collected yet to answer a population-based question, but there are many studies in specific populations.
I'm going to go back to Commissioner Edwards for another question.
I haven't got any answers to any of the questions I've heard asked here tonight yet, to be honest with you. Those, you're kind of beating around the bush, and I'm not much for beating around the bush. I have to say, the risk is there. I don't think we're ever going to get away from risk, but I think it's very minimal in the scheme of things. And when young people become depressed, one young person committing suicide is obviously way too much. So I see this as being too detrimental to our society to have this kind of dance around the issue. We're not getting any answers. When I walk out of here tonight, so far, I don't have an answer to give a constituent when they ask me, well, when might this happen? When can we look towards this? When can we look towards that? That what if, and wait, and let's study, and and change the goalpost as we go along is not satisfactory to the citizens. And I haven't heard one bit of information that could address one concern that parents brought to us tonight. So I'm disappointed. I'm going to be prepared to make a motion here shortly, if I can get a second, that we ask the doctor to write a letter explaining everything that you've heard tonight from parents and put it in detail so it makes sense, and it's not just kind of dodging the question and then asking you to expedite opening the schools. And I mean expedite, not after we've studied it for another month. We need to do something now and let the schools know that we're on their side, trying to get this thing opened up. As long as we act in a hesitant fashion, they won't ever open. I mean, I see you've got the teachers way down on the spectrum. I don't know who made that decision about getting vaccines, but to me, that I'm willing to give up my vaccine so teachers can take the vaccine and get the schools open. I don't think everybody realizes the importance of this. So I'm going to just let that go for now.
Commissioner Mejia, or unless you had a response, Dr. A, I don't want to cut you off. That sounded like a statement more than a question, but you're welcome.
Well, I would like an answer that's a real answer.
Okay,
so
very good.
my response is there seems to be some miscommunication. When people hear that we are looking to see at what transmission level schools reopen, it's not an if schools are going to reopen, it is a when schools are going to reopen. And I want to reaffirm that commitment. So that's definitely something that we will be sharing with the community. And that is definitely something that we can take back to our family members and to the community at large. I just wanted to make sure that I shared that. In terms of, so I am concerned about the mental health of our students and about the young people in our community. It is a matter of balancing risk. I know that that here in this board, we know this. There's a risk of long-term impacts. There's a risk of illness. What the infectious disease modeling has showed us is that mitigation works and is the best way to modulate risk in our schools. I can say that there are plans in place across the county for schools to reopen safely. So those are concrete things. Those are in place, taking place right now. We are meeting weekly, as we have been, with our school superintendents. It is a close collaboration, and we recognize that in conjunction with local health jurisdictions, the ultimate, in conjunction with local health jurisdictions, our school administrators, we all share that responsibility in opening schools. However, I am in an advisory capacity as health officer.
Okay, I never did hear an answer to Commissioner Mejia's question, to be honest with you. So, okay.
Commissioner Mejia.
Go ahead, Chair.
Doctor, I believe there has been miscommunication. I mean, parents, teachers, staff, the kids, the schools, I mean, they want and they need a plan. This is a statement, it's not a question, but I believe that a date needs to be set. For example, King County their health officer recommended for a date to be set, and the school set a date in the future. And I believe we need to follow that. I believe that at that moment, schools will have ample time to make a plan. Parents will have enough time to prepare. Kids will have enough time to prepare. And if things get worse, if the numbers start going up, then at that time, that date can be reevaluated. But I think what has everyone frustrated is kind of the wishy-washiness of everything. I'm a parent of a 7-year-old child in first grade, and I know how she's struggling, how we have to adapt, we adapted to this whole situation. But I know parents who are way worse off, who are really struggling, who have multiple children, and I think the request from the citizens is just, we want a plan, we want something set forth. Same, I think I've heard from parents, teachers, staff. So that's just going to be my statement. But I'll switch it over to vaccine distribution now. I just want to know, we talked a little bit about the distribution and how we're kind of low on the distribution out of the 4,375 vaccines that we received. What is the county's plan to accelerate the pace of distributing the vaccine? I know that you're not specifically giving them out, but is there a plan to accelerate?
So that happens at the federal. So that happens at the federal level. The federal government allocates to the states. The states then allocate to vaccine-capable providers. When there is sufficient supply, we do anticipate being able to accelerate the rate of vaccination in our county. At this point, the major limitation is supply.
Thank you.
I'm going to ask a question. I'm going to ask, I think there are two related questions about just how the vaccine works. I'm just kind of curious. The first question is why is it, the vaccines aren't approved for kids? And I'm wondering, is that because there's some reason to think it wouldn't work in kids, or is it just because they haven't had the trial, they haven't had like trials with kids to know? It's kind of like being cautious with the unknown, or is there something specific that you would not want to vaccinate the kids?
So at this time, it's caution with the unknown.
Okay. Well, I'll just stop you there because there's a lot. I get it. And then my other question was, which is related to this, is on your slide that says, so a couple confusing things. You said, your slide says COVID-19 can still be spread even by those who have received both vaccine doses. But then what you said was that we don't know if that's true or not. And I was wondering, and so that's my first question is, and if we did, and then related to that is, if it is true, then I'm just trying to figure out the risk to families and households. Like if I get it, like I'm on the list for January, I guess, because I'm over 50 and I have multi-generational households. So if I get it and my kids and my wife are down the chain and I can spread it, but I don't get the symptoms, aren't I actually putting my unvaccinated household members at greater risk, because now I won't know to get tested and treated and quarantine myself?
So that's why it's absolutely essential that we keep doing the same things that we've been doing since the beginning and keeping ourselves safe and preventing the spread of COVID-19. So really, what this means is COVID-19, the illness, is prevented by the vaccines. We know that. The transmission of SARS-CoV-2, the virus that causes COVID-19, is the wild card that we're still looking into. There is some early evidence that suggests that these vaccines may prevent that spread as well.
But your slide says COVID-19 can still be spread even by those who have received both doses. That's not exactly accurate. You're saying
so it is unknown. That we will be issuing a correction.
Okay, I'm back to Commissioner Edwards if you have another question or comment.
I really don't have the answer that Commissioner Mejia asked really yet. Is there a date certain that you could give us right now so citizens would know and schools would know that we're going to open up here? We need to do something. We can't just keep talking about it. And I have to say, I'm ready to make a motion that we send you a letter asking for that date certain and put it in writing, not something beating around the bush.
So I would like to address that, Commissioner, and I appreciate, I definitely appreciate the passion that you have for our schools and the importance that schools have in our community. I would like to say that my guidance. So I said that I would write a letter in 3 weeks, stating where we're at and the guidance that must be followed at that time. Specific dates are going to be set by schools based on their operational constraints. I am a health officer. I provide the guidance in terms and I provide support in terms of helping the schools operate safely and use the appropriate guidance. The specific dates will be set by the districts based on their operational needs and capacity.
Right, the opening dates I realize are going to be set by the school district, but you, by setting a date January 15th, I encourage schools to open up as safely as possible. What's wrong with something like that? So they can move forward.
So looking at that, at the letter that I sent, there will be another letter on the 21st, which is 3 weeks from January. At where we are at that point will tell us what our community transmission level is likely going to be heading into spring. At that point, based on our community transmission level and our capacity in keeping with the State Department of Health's guidance, our schools will reopen at the appropriate level based on all of the guidance and rubrics that we have received from the governor.
I see the county manager had his hand up, sir.
Go ahead, Ramiro.
Yeah, thank you, Doctor. Without getting too much into the repeating the same question, I think you sort of answer when you're going to be issuing the next letter. I think it's January 21st. But as you stated, it seems to be a miscommunication, and I don't know where. Based on January 5th letter that you sent, the superintendent, as I understand, sent a letter to the parents stating they still need to have a green light from the health officer to move forward. So there is not even an indication, I believe, from the school superintendents. There is not about when, it's still about if. So where that miscommunication has been, if you can clarify that.
We do meet with our superintendents on a weekly basis. In terms of how we reopen, we are going to be reopening in as per the state guidance. In terms of where that specific piece of communication is different, I don't know. I will look into it.
Yeah, because that seems to be what I understand. And, it just happens to, my wife works for the school district as well. And the correspondence from the superintendents is still the if we're going to be open, and we're still waiting for a guidance from the health officer. But as you stated today, is when. And I don't know, obviously we cannot influence the decision-making process from the school districts and the school superintendents. But at some point, it will be good to be clear on the message as to when, not if.
Commissioner Mejia, it's your turn. If you have anything additional to ask.
I don't have any additional.
Okay, so I'm going to ask about now the vaccine rollout. For one thing, just as a preliminary comment, I don't know who came up with these labels, but the charts, we're talking about 1A and 1B, but the chart is backwards. It says B1 and B2 and B3, and then there's tiers within the phase number, and it's horrifically confusing for people to understand what's going on. It's got to be, 1A and then 1B makes it sound like the one's consistent. You're going to go 1A, 1B, 1C, but then the chart shows B1, B2, B3. So we need to get our nomenclatures straightened out so people can understand this. I strongly agree with the person that testified today about the teachers' vaccinations. I would feel a lot more comfortable about school reopenings if we were showing that we cared about, I mean the whole state, the whole apparatus. I'm not pointing the finger at you, but so B1, all people 50 years or older in multi-generational households. That's just like 50-year-old parents with kids. That's me. Not as a county commissioner, but just as a guy. Whereas my wife, who's a 48-year-old kindergarten teacher, is like two steps down the chain, and I'm going to be sitting in my office by myself while she's in a crowded classroom of 15 kindergarten students unvaccinated. I don't know where this 50 came up with, but it really doesn't make any sense to me. I understand people over 70 but to break congregate care people into 50 and over 50, and then multi-generational, I could get it if I had my parents living with me. That's not what it says. It doesn't say, it's basically going to be defined as, parents, just ordinary parents. Lots of parents are 50 years old. So I'm not understanding that. And I think that I've heard a lot of concern from teachers. I'm around teachers a lot because of my wife. And I have neighbors who are teachers. So, I mean, there are concerns about the vaccine rollout. And I guess, I know you didn't dial up this chart, but is there anything you can illuminate about the thinking behind teachers 4 tiers down the list, whereas anyone over 50 with kids would get vaccinated in tier B1?
So tier B1 isn't just 50-year-olds with kids. The intent is for folks with vulnerable household members in terms of that multi-generational household piece. I know that we're still getting some clarification from the state on that specific piece of guidance. As far as teachers, so it's with our current supply of vaccine, there isn't enough to do, because there isn't enough to do everyone in all of these critical infrastructure roles at the same time, and that's the reason for the age delineation by Department of Health. They've sliced it and diced it and looked at all the different possible ways to break out that 1B category, because this is the 1B category put forth by the CDC, and then made appropriate for the Washington state context. So I agree that critical infrastructure workers are important and deserve priority for vaccine, and that folks that work in congregate settings and in places where they can't necessarily distance are at higher risk. And that's I know that was the guiding principle for DOH in putting this together. My hope is that if our vaccine supply increases, that this will change. So the more vaccine we have, the faster we can vaccinate everyone in phase.
Chair, could I make a comment?
Your turn, Commissioner.
I have to say, I don't want to call people names here, but I just don't get it. Teachers are entrusted with our most precious possessions, if you want to call them that, our kids. I mean, they're our future, and they're rated the same as our criminals that are convicted and in prison as far as getting this. I don't care about the prisoners compared to our teachers and our kids. Whoever came up with this chart is not, I don't know, the lights weren't all on. I'm going to try to be polite about it, but I hope you will take those frustrations back to the state health department or whomever.
Will do.
I had a question on your January 5th letter made a reference to the new strain that came from UK or whatever. And I just wondering what you can tell us about that. What are you learning about that? I mean, I saw charts from UK and Ireland where, they just flew vertical, in terms of the virulence of this new strain. And I was really excited. I'll be honest with the public. I mean, I was really excited about the new guidance in December for school reopening. I got less excited as I saw this new strain and how it arrived in California. And now, I have every reason to believe it's going to land in Washington. And I'm just afraid our schools are going to go through all this effort and then it's all just going to explode on us because this strain. And so I've been watching the news very carefully, but any light you can shed on that to make me feel more concerned or less concerned, I'd certainly be interested in hearing, Doctor.
So we don't have documented cases of the new strain yet in Washington state. the risk posed by the new strain is largely an increase in transmission, and that's why we're watching that transmission rate so closely. In terms of, and I'm also following the CDC pretty closely as well in terms of, as we know more, as more cases come to light, whether there's specific differences or changes that we need to make in our mitigation measures. So I'm following all of that pretty closely. On the more reassuring note, there is some our vaccine manufacturers are looking at whether or not at the efficacy that the vaccine has against these new strains and against the UK strain. So far, the most recent studies that I saw looked pretty good. The South African strain, I'm still waiting on those studies.
Is this
Sorry, go ahead, Commissioner.
Is this posted on our website so citizens can go to it and try and decipher it as best they can?
Is what posted?
This information we've been given tonight, this presentation, and the different stages. And I have to say, I had the same concerns about 1A and B1 and B2 and 1B and all that mix up, but.
That is available.
Is it there so citizens can go look at it on our website? It's there?
Shelley's nodding.
Yeah.
Okay, could we maybe state the website or something so some of those folks can look?
Yeah, on the front page of the public health website, we have a COVID-19 page.
Okay.
And I believe you click in there, it gives you all the resources and also all the associated links to the State Department of Health where you find this.
Okay, thank you.
Okay, well, I would propose that we close this item if there's no further comment or questions. It's 5:13. We've certainly got time, but there's other items on the agenda. Is that acceptable to the board? Any other questions, I guess is what I'm asking, or any other?
No further questions for me, Chair.
I'm okay.
Okay, thanks, sir. Thank you, Dr. Abdul-Malik. Tough questions and tough issues, and I thank you for answering the board. And we're going to move to Board of Health members, health-related activities. Standing item number 5, Commissioner Edwards. Anything to report?
I can put mine in real quick on this issue. It's all about the COVID, all about the schools, and the health issue of the Nisqually River flooding, I guess, is a health issue. But that's where my whole thing has been wrapped up around opening schools, doing something for the vaccine, being efficient. People don't like to hear about vaccines being thrown out or misused, and they'd like to have answers. So I'll just let it go with that.
Commissioner Mejia.
I have nothing.
Okay.
Thank you.
I'll just briefly, I had a chance to attend the opioid task force meeting this month. It meets every other month now, but I try to attend those, and work's moving forward there. I attended an interesting meeting of a new advisory committee to the Providence Community Care Center. There's an executive committee that deals with the future of that project, and they've got an advisory committee, and so I got to learn kind of the history there, and there's some future planning going on as to how we might make that, again, a productive piece of our health picture in Thurston County. I continue to work on, we had our presentation last month on climate and how it relates to health, and I've continued to work on the phase 3 subcommittee, trying to lay out a structure for implementation of a climate mitigation plan that will be considered by the full board later this month. So that's my brief report. We're going to go to health officer's report. Dr. A has been on the hot seat here for most of the evening, but is there anything else you'd like to report on besides what we've discussed with vaccine and COVID?
So just a brief report from me tonight, and that's reporting on the activities of our disease control and prevention team here at the Thurston County Public Health and Social Services Department. Over this past month, our team has investigated and followed up 82 confirmed and suspect cases with a wide variety of illnesses, including, Campylobacter, chlamydia, chronic hepatitis B and C, antibiotic-resistant organisms, Shigella, syphilis, TB, among others, in addition to all of the support that our DCP team is giving our COVID response. Of note, the mitigation measures that we have for COVID also are giving us a better flu season. So there have been no lab-confirmed influenza deaths for the 2021 season to date, which is pretty incredible. And no influenza-like illness outbreaks in long-term care facilities for the 2021 season to date. So all of the masking and hand washing and distancing is sufficient for our garden variety respiratory illnesses. So we're seeing a better season. We're seeing a better season there. And so I hope everyone continues to follow all of those precautions, not just for COVID, but to prevent all of these other illnesses as well.
Thank you. Any questions for the doctor on her report?
No questions for me, doctor.
Hearing none, I will ask for Shelley to give a director's report from Public Health and Social Services.
Thank you so much. I do want to say thank you to all of the constituents who spoke today and all of those who are sharing all their perspectives with us by email. We do hear you. We appreciate your voice and take it very seriously into consideration. So thank you so much. I also want to take this opportunity to say thank you to all of our staff and volunteers who have been working on the COVID response for almost an entire year. They work tirelessly around the clock, 7 days a week, do an amazing job, and I just cannot thank them enough. And now we are also adding vaccine planning and distribution, which is a huge endeavor to our line of work as well. And we really appreciate all of our volunteers and community partners who are helping to end this pandemic for our community, hopefully soon. And in addition to all of that, there's still other amazing work that's happening. And I would just like to highlight some of our other programs that are doing work that is not COVID related, and to share bits of good news of other things that we're doing to achieve the highest level of health and well-being for everyone in our community. In our maternal child health program, our nurse family partnership nurses have conducted 381 visits to mothers with young children in need. In addition, that team also is participating in our contact tracing and case investigation for COVID response, as well as becoming vaccinators themselves to help in this effort. So we're very grateful for our public health nurses. In our developmental disabilities program, our high school transition program is supporting students, even though they're not in school, in getting back to work. And so there have been several students and participants who've been able to work despite the pandemic, and we're really proud of them for their achievements. In our Veterans Assistance Program, we've had 13 new veterans receive assistance and support services in the month of December, which is a stark increase to previous months. So really happy that our veterans team is able to continue to support them. In our housing, also, our Office of Housing and Homeless Prevention, the Eviction Rent Assistance Program has provided over this last year $2.9 million in rental assistance, with more to come in our community soon. So we're very happy about that, as well as $2.6 million in emergency shelter grant funds to provide extra support to our homeless service providers. And we're very grateful to all of our providers and partners in doing that work and helping those in need. On January 29th is our annual point-in-time homeless census. This year, due to COVID-19 and health and safety concerns, the count is not being conducted in the same way that it has in the past. There will be a statistical count of those who are in shelters, as well as a visual count of unsheltered individuals with our Thurston County staff, as well as with the City of Olympia, but we will not be doing some of the same outreach events that normally happen this year. In our Other programs, our Youth Mental Health First Aid training series is a partnership with Educational Services District 113, trained 30 people to assist young people in experiencing crisis. And that is key strategy in helping to focus and prevent youth suicide. So we're very grateful for that. Last month, actually it was 2 months ago now, I believe, the Board of Health adopted a change to the sanitary code prohibiting smoking and vaping in public places of employment and certain youth-oriented outdoor public places. We've sent out mailings to over 10,000 businesses countywide. I've had very positive response on that. We're also supporting local childcare providers and ensuring that they have safe and healthy products to clean and sanitize so that they can safely serve children. 14 childcares, along with 39 staff, recently participated in our pilot project to help support childcare centers with safe products for the next 6 months. And then finally, for those that are interested in being more active in supporting those with behavioral health needs in our community and making a difference, our treatment sales tax program is currently accepting applications for new members on our Treatment Sales Tax Advisory Committee, which advises the Board of County Commissioners. And if anyone is interested in getting engaged in that work, there's applications available on our website. And with that, I'll answer any questions that you have.
Questions for Shelley?
I do have a question.
Go ahead, Commissioner.
I'm going to get off this topic because you don't want me to be on this topic anymore. When we have citizens that serve on committees like you just mentioned, and then they go on about their life, do we give them a letter of recommendation or a thank you or something recognizing their commitment and service to the community?
Typically, I believe we do, but I will definitely check into that in terms of the Treatment Sales Tax Advisory Committee.
I guess anything that really, that you would oversee, that would just be one of them, but I'm just kind of curious, we probably do need to be better at thanking citizens for stepping forward and going through this frustration.
Absolutely.
Good point.
I don't have any questions. Just thank you, Shelley.
Thank you.
Okay, I do not either. So with that, at 5:22, we are adjourned. Thank you, everybody.